Hello everyone and Assalamu alaikum. I hope you all are doing well. I'm Dr. Harsha from Dubai, Pakistani national. My education is MBBS qualified doctor. You are listening me at the platform of specialist Anam SH. I'm here to discuss your health issues and to provide you the authentic information. Today our topic is about how to get pregnant. But first, please do like and subscribe our channel, Specialist Anam SH. By that, you can get our all informative videos notification. Thanks. Let's go to the topic. Trying to conceive 10 tips for women. To optimize women's fertility, taking better care of their bodies is a good first step. But what else can women do to improve their odds of having a baby? The most important advice for a woman who wants to get pregnant is to get to know her body, specifically her menstrual cycle. It's important to know how far apart her cycles are so she can more accurately time intercourse to try to get pregnant. Number 1. Record menstrual cycle frequency. A woman who wants to have a baby should monitor whether the first days of her periods tend to come the same number of days apart every month, which is considered regular. Conversely, her periods may be irregular, meaning her cycle lengths vary from month to month. By tracking this information on a calendar, a woman can better predict when she might be ovulating, which is the time when her ovaries will release an egg every month. A woman's egg is fertile for only 12 to 24 hours after its releasing. However, a man's sperm can survive in a woman's body for up to 5 days. Number 2. Monitor ovulation. Women with regular cycle ovulate about 2 weeks before the arrival of their periods. It's harder to predict ovulation in women with irregular cycles, but it usually occurs 12 to 16 days before the start of her next period. There are several methods women can use to help determine their most fertile days each month. Number 3. Have sex every other day during the fertile window. The fertile window spans a 6-day interval, the 5 days period to ovulation, and the day of it, according to the American Society for Reproductive Medicine. These are the days each month when a woman is most fertile. Some women are turning to new technology tools such as fertility tracking apps and websites to help them keep tabs on when they may be more likely to conceive. Number 4. Strive for a healthy body weight. Being too heavy can reduce a woman's odds of conceiving, but being too thin can make it more harder to have a baby. Research has shown that a woman who is overweight can take twice as long to become pregnant than a woman whose BMI is considered normal, and a woman who is underweight might take 4 times as long to conceive. Having too much body fat produces excess estrogen, which can interfere with ovulation. Losing 5 to 10% of body weight before a woman starts trying to get pregnant could improve her fertility. Number 5. Take a prenatal vitamin. Women who are attempting to conceive start taking a prenatal vitamin even before becoming pregnant. This way, a woman can find one that's more agreeable to her system and stay on it during pregnancy. Number 5. Don't overdo it. Having sex every day, even during ovulation, will not necessarily increase your chances of getting pregnant. In general, every other night around the time of ovulation helps increases your chance of getting pregnant. Sperm can live up to 5 days inside your body. The best suggestion is to have sex regularly when you are ovulating and when you are not. Number 6. De-stress any way you can. Try not to get stressed out about starting a family. You may roll your eyes if someone says, just relax and it will happen, but stress can actually actually interfere with ovulation, so the more relaxed you are, the better. Whatever helps you de stress is fine as long as it's healthy. There is some advice that acupuncture can help reduce stress and increase your chances of becoming pregnant. And although drinking too much alcohol when trying to get pregnant isn't smart, a glass of wine won't hurt. Number 7. Live a healthy life. Exercising is a healthy habit, especially if it helps keep you and your ideal weight, just like anything else. Though you can get too much of a good thing, too much exercise can cause you not to ovulate. Number 6. Eat healthy foods. Although there may not be a specific fertility promoting diet, eating a variety of healthy foods can help prepare a woman's body for pregnancy by giving her adequate stores of critical nutrients such as calcium, protein, and iron. This means eating a variety of fruits and vegetables, lean protein, whole grains, dairy, and healthy source of fat. Besides taking a supplement containing folic acid, a woman can also obtain this B vitamin from foods such as dark green leafy vegetables, broccoli, fortified breads and cereals, beans, citrus fruit, and orange juice. Number 7. Cut back on strenuous workouts. Being physically active most days of the week can help a woman's body prepare for the demands of pregnancy and labor, but getting too much exercise or doing frequent strenuous workouts could interfere with ovulation. Doctors see a lot of menstrual disturbance in women who exercise heavily, and a lot of times these women need to cut back on their workouts if they want to become pregnant. Number 8. Be aware of age related fertility declines. This is very important. As women get older, their fertility decreases because of age related changes. Number 8. It is important to know, be aware of age related fertility declines. As women get older, their fertility decreases because of age related changes in the ovaries that cause a decline in the quantity and quality of her eggs. With advancing age, there's also an increased risk for some health problems such as uterine fibroids, endometriosis, and blockage of the fallopian tubes, which can contribute to a loss of fertility. There's a gradual fertility decline in women beginning in their 30s, a sharper decline after age 37, and a steep decline after age 40. These declines mean it may take longer to become pregnant. Number 9. Kick the smoking and drinking habits. Smoking can lead to fertility problems in both women and men. Chemicals found in cigarette smoke, such as nicotine and carbon monoxide, speed up the loss rate of a woman's egg. Number 10. Know when to seek help. Both the man and woman should consider having an infertility evaluation if the woman is 35 or older and has not become pregnant after 6 months of having sex regularly without using birth control. Also recommended that a woman who is under 35 and her partner should consult a fertility specialist if she has failed to become pregnant after 1 year of having unprotected intercourse on a regular basis. Here are some more tips to get pregnant faster. You are ready to get pregnant? Now, once you are ready to start a family, waiting is the last thing you want to do. Although Mother Nature has a hand in the timing, there are some things you can do or not to do to help increase your chance of getting pregnant as soon as possible. Number 1. Get a preconception checkup. Before you officially start trying, get a checkup. Ask your doctor about prenatal vitamins that have folic acid, which helps protect against some birth defect, such as spina bifida. Folic acid works during the early stage of pregnancy, so that's why it's important to make sure you're getting enough folic acid even before you get pregnant. Do this the cycle before you start trying. If you have any underlying medical problems, they need to be under control before you can safely become pregnant. Number 2, get to know your cycle. How much do you know about your menstrual cycle? Really understanding helps you know when you're most fertile. Ovulation is the best time to get pregnant. This is the time to focus on having sex. It helps to become aware of it helps to become aware of the signs of ovulation, such as a change in your cervical mucus. It usually becomes thin and slippery when you are most fertile. Some women may also feel a one sided twinning of pain. Number 3, don't worry about the best position for getting pregnant. Myths about the best position for getting pregnant, but they are just that, myths. There is really no There is really no scientific advice saying that the ministry